Atrial fibrillation, or AFib, is an electrical problem of the heart. A healthy heart beats regularly to pump blood around the body, controlled by electrical impulses from the SA node, the heart's natural pacemaker. When someone has AFib, the electrical signals in the top chambers of the heart, or atria, have become irregular, which can lead to a faster heart rate in the bottom chambers of the heart, or ventricles. When experiencing AFib, symptoms may include fatigue, shortness of breath, dizziness or lightheadedness, palpitations, or chest pain. This is due in part to the heart not fully and effectively pumping blood through the body. About 60% of people who have AFib experience symptoms, while the other 40% don't experience any symptoms at all. AFib is one of the most common arrhythmias or irregular heart rhythms in the United States, with an estimated 2.7 to 6.1 million people already diagnosed. Common risk factors for AFib include high blood pressure, obesity, diabetes, hyperthyroidism, sleep apnea, and heavy alcohol use. Sometimes people can develop AFib even if they don't have any of these risk factors and lead a healthy lifestyle. Early treatment is the key to managing AFib. If left untreated, AFib can permanently change the size and shape of your heart through a process called remodeling. For people with AFib, one of the most significant complications they can experience is the risk of stroke. When the top chambers of your heart don't fully contract, the blood doesn't completely empty out. When blood isn't moving in the heart, blood clots can form, potentially dislodge, and travel to your brain, causing a stroke. According to the American Heart Association, those with AFib are nearly 5 times more likely to have a stroke than someone who doesn't have AFib. You can lower your risk of stroke by working with your care team to find the right treatment plan for managing your AFib. To properly assess your condition, our specialists may order one or more of the following tests: electrocardiogram, EKG or ECG. This will assess your heart rate and rhythm. Event or Holter monitor. This device can monitor your heart rate and rhythm over a specified period of time. Echocardiogram or echo. This will allow our specialists to look at your heart structure and function using ultrasound. Transesophageal echo or TEE. An echo probe is inserted into your mouth and down into your esophagus to look into your heart. Stress test, used to evaluate how well the heart works during physical activity by measuring your blood flow. A normal heart rate is between 60 and 100 beats per minute. A normal heart rhythm, as seen on an EKG, beats in a regular, orderly rhythm where each beat looks like the previous one and is evenly spaced with each other. After testing, if you're completely asymptomatic, a rate control strategy may be recommended. With this method, you would stay in AFib, and the goal would be to control your heart rate or keep it from beating too fast by using medication. If you're symptomatic, or if your heart rate is difficult to control using medication, a rhythm control strategy may work better for you. For this method, the goal is to restore a normal heart rhythm and keep you in it, using a combination of medication and medical procedures. There are a few medical treatments and procedures that can be used to help manage your condition. Depending on the severity of your AFib, your specialists may recommend one of the following: antiarrhythmic agents, sleep study testing, direct current cardioversion, catheter ablation, AV node ablation and pacemaker implant, a Watchman device implant, hybrid combined ablation. Antiarrhythmic agents are a group of medications that are used to suppress abnormal rhythms of the heart, like atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. Your specialist may request a sleep study be done to assess if you have any underlying medical issues, like sleep apnea, that are contributing to your AFib. An overnight sleep test can be done at home or more commonly in a sleep laboratory. A sleep test will measure blood oxygen levels as well as the brain and heart rhythms during sleep. A direct current cardioversion is a procedure to reset the heart rhythm by shocking the heart with an electrical current. The shock lasts for less than a second. Some people need more than one shock to restore their heart rhythm. The pulmonary vein brings back blood from the lungs to the heart. Abnormal impulses from the pulmonary vein can cause AFib. A catheter ablation can help block those impulses and prevent AFib. A thin, flexible wire called a catheter is inserted into a vein near the groin. The catheter uses an energy source to either create an electrical burn, which is called RF ablation, to the tissues around the pulmonary vein, or freeze a ring of tissue. That's called cryoablation. A last resort procedure that can be used is called an AV node ablation. This is a procedure that we only consider if antiarrhythmic therapies and ablation have failed. A catheter is inserted into your heart and used to intentionally damage or burn out the tissue that connects the top part of your heart to the bottom part of your heart. This disconnect will not get rid of your atrial fibrillation, but it will cause a complete heart block, and it'll require placement of a permanent pacemaker to make the bottom of your heart beat at a stable rate. Therefore, you will be pacemaker dependent. The Watchman device is an alternative treatment option for patients who suffer from AFib not caused by heart valve problems and need an alternative to blood thinners. This procedure is a permanent implant designed to close the left atrial appendage of the heart in an effort to reduce the risk of stroke, and also eliminates the need for patients to take blood-thinning medications, which can be costly and limit your activity. A hybrid combined ablation utilizes radio frequency to block irregular electrical signals by producing lesions or scar tissue on the heart. The convergent procedure combines an ablation performed on the back wall of the heart's left atrium by a surgeon with a cryoballoon ablation on the inside of the heart performed by an electrophysiologist. Our experienced electrophysiologists and specialists are here to guide you on your healthcare journey. When you see your healthcare team, be sure to bring a list of your current medications and any questions you may have. We want to help you manage your condition so you can continue to enjoy life on your terms. The best way to control your symptoms is to ensure you're following the care plan outlined by your clinician. Every day, you should take your medications, eat a low-fat, heart-healthy diet, and exercise. Be sure to balance your activities with times of rest. Following your care plan should allow you to go about your normal activities and experience minimal to none of your AFib symptoms. If you begin to experience mild to moderate AFib symptoms, like a persistent fast heart rate, any signs of bleeding, or the return of frequent AFib episodes, you should call your clinician's office right away to schedule an appointment. Symptoms like severe shortness of breath, chest pain, dizziness or weakness, severe bleeding, facial drooping, loss of balance, trouble speaking, trouble walking or moving your arm are all signs of an emergency. You need to call 911. Managing AFib can be overwhelming. Let our team of board-certified specialists help you on your journey to better health. Schedule an appointment with one of our specialists today.